So
Okay,
the bigger change, periodontitis. We should go into that one.
the big guy.
Okay, so this one, periodontitis, is the one that we are now staging and grading. And we do not do this with health, with intact bone. You will still stage and grade if they return to health after having periodontitis. I want to clear that up because when it first came out, my colleague Jessica Atkinson, she was staging and grading everybody. She was like, I think I know what this means, but everybody with health and gingivitis, she was giving them a stage and grade. And you do not need to give a stage and grade to anybody unless they have an active periodontal microbial infection causing periodontitis as the diagnosis. Okay. So keep that nugget in the back of your mind. So, stage, we're going to give our patient a stage from 1 to 4. Okay. And I'm just going to tell you already that you already know these patients. They did not change what initial, moderate, or severe or very severe periodontitis looks like. It's going to be the same as what you are already doing it, but along with that verbiage, we're going to put a number 1, 2, 3, or 4. So mild is 1 or slight, and then moderate is 2, severe is 3, and the documents say very severe is 4, but a lot of people, they kind of chunk that together in the actual like table. So I encourage you to go and look at the periodontal tables, perio.org. They have these little grade tables you should print off and collaborate with your dentist, because your dentist is ultimately actually responsible for making the dental hygiene diagnosis slash AAP classification, depending on where you're located in the world. Okay. So, hygienists are really invested in this. And most of the time, the dentists don't really know that there was a change. So we're really having to guide them and educate them on what this means because they are ultimately responsible. So staging essentially says, how bad is it, doc? How severe is it? So we took a model from cancer and we applied it to this disease, this condition. So I had a family member who texted and said, I have cancer, I have a tumor in my hip, and we're going to see what stage it's at and what grade it is. So we have to do a little biopsy.